also do addiction.
Yeah, I don't do that very much anymore, but we have the problem. So coming back to the story of why I transitioned from psychiatry to anti-aging and stem cell therapy is because psychiatry is not addressing the root causes. Let's say I'm treating someone with depression, but I'm not evaluating the person if the person is getting proper nutrition. Is the person's hormone really optimized? Is the person toxic from some substance? Is the microbiome balanced? We're not looking at any of those. We just start throwing drugs because that's what we're taught to do. Either in medical school or residency, we are drug focused. So it's all about drugs. We want to diagnose people very badly because we want to connect them with a drug. Without a diagnosis, we can't justify giving anybody drugs. So the diagnosis will allow us to write a prescription, and that was, where our pride is at, right? We can prescribe you medication to alleviate suffering. Unfortunately, those medications, almost all of them are not addressing the root cause. Temporarily, I'm not saying they're not useful. I think for emergency use, they can be life-saving and powerful, but that is not the long-term solution. So even for something like addiction, I was a medical director at a few rehab centers in Malibu. So I saw firsthand how things were done. Unfortunately, we are still using the drug model. So even if I try to be integrative, I try to address the root causes. Let me send you, some labs. I want to test your hormones and your nutrition, and let's see what kind of supplement we can give you to augment, boost your own system or repair your brain. By the time I'm giving them supplements, a lot of these patients in the rehab, people in the rehab, were telling me, hey, doc, my insurance is not covering the supplement. So can you just write me a drug? So that was very disheartening, right?
Yeah.
I did all this work.
When they say just write me a drug, what kind of drugs are we talking about?
Antidepressant, antipsychotic.
These are the things you would use for addiction.
Yes.
Okay.
Yeah. Those are the bread and butter. So the problem is that we're not addressing the root causes. What I believe the future of medicine is that everybody is going to be practicing anti-aging medicine. You can call it anti-aging medicine or integrative medicine or functional medicine or even naturopathic medicine. They're all about the same, which is looking at the body as a very complex entity, that everything is affecting each other. And there are common denominators. So nutrients is one of the common denominators that affects everything, multi-organs. The microbiome affects multiple organs. Right? Hormones, multiple organs. You're looking at what can affect all these things and how they're all connected. So that should be taught in all medical schools across the board. Whatever specialty you're going to, you've got to be fluent in this integrated medicine language. So you want to address all that first. And then you use your specialty knowledge to do things maybe you have other methods of treating a particular problem. Maybe some people need surgery. Maybe some people need some kind of heavy duty drugs, maybe. But you want to fix all the foundations first, not to mention you're improving the health of all these people overall. And whatever other intervention you're doing in your specialty, people are going to do better because their overall health is out.